Hey guys, a very good evening. Today's topic of my discussion is staging of carcinoma cervix. Staging of carcinoma cervix. We all know that carcinoma cervix have 4 stages. Okay, so first stage will start with stage 1. We all know that. So before jumping into stages, just remember a simple funda. In staging, always the values will be less than or equal to, like in this way. Okay, greater than will be single greater than, there will be no greater than or equal to, so less than or equal to is the thing. Okay, so stage 1 is something like, it is a microscopic one. Microscopically only we can see this, like if you want to see that in the carcinoma cervix, in the microscope only we can notice that some sort of carcinoma is there. Okay, so stage 1 is again divided into 1A and 1B. 1A is divided into 1A1 and 1A2. So basically the cervix have a tumor, so it has some depth of invasion. So depth of invasions will measure in mm, because it is microscopic one, so we will measure this in mm. So in 1A1 the depth of invasion will be that much small that it will be less than or equal to 3 mm. Okay, whereas the 1A2 is more than 3 mm, or less than or equal to 5 mm. Okay, so funda what I said, less than or equal to, so less than or equal to 3 mm, less than or equal to 5 mm. That is about stage 1A and 1A2, 1A1 and 1A2. 1B is again divided into 3 types: 1B1, 1B2 and 1B3. Okay, so 1B1 is something like, here we will also see the depth of invasion and the greatest dimension the tumor expanding. Okay, greatest dimension, for example, is the tumor, so depth and also the greatest dimension it is expanding, that is about greatest dimension. So 1B1, so we already came till less than or equal to 5 mm. So in 1B1 it will be more than 5 mm. So it's already becoming from 5 mm to centimeters. So 1B is something like mm to centimeters. So more than 5 mm and greatest dimension will be less than or equal to 2 centimeters. Okay, 1B2 and 1B3. 1B2 is, already I told, less than or equal to less than 2 centimeter here. So the depth of invasion here, it will be more than 2 centimeter, okay, but it is less than or equal to 4 centimeter, whereas 1B3 will be more than or equal, more than 4 centimeter. Okay, so 1B1 is 5 mm, more than 5 mm, greatest dimension will be less than or equal to 2 centimeter. 1B2 is more than 2 centimeter but less than or equal to 4 centimeter, and 1B3 is more than 4 centimeter. Okay, before jumping into stage 2, I will tell about treatments. If a lady comes with stage 1A1, okay, stage 1A1, and she's very young lady, 19 years old, so we can't do hysterectomy in her because she need to get married, she need to get child and all. So for such conditions, in 1A1 we can go for conization. What is that? Conization, like the tumor can be removed by means of cone. Okay, that is only done in stage 1A1. Okay, whereas stage 1A2 we can go for radical trachelectomy. What is that? Radical trachelectomy. Like we'll remove that mass and the adjacent structures will remove. Okay, but if she's 19-year-old, family not completed, then if a lady came who like she's already family completed and all, then you can go for hysterectomy. But what kind of hysterectomy you'll do? Basically in 1A1 and 1A2, okay, with lymphovascular space invasion or any kind of 1A2, we can go for modified radical hysterectomy plus pelvic lymph node dissection. Remember this. Okay, for old lady came with all this, or any lady with lymphovascular space invasion, then you will go for modified radical hysterectomy plus pelvic lymph node dissection. So sometimes they won't give modified radical hysterectomy, they will give type 2 hysterectomy. Remember that also. Okay, that's about stage 1A. Now coming to stage 2. So from here onwards, we can see from the naked eye as well. So stage 2 is something like if the uterus is involved, if the uterus is present like this, and cervix, and this is vagina. So stage 2 is again divided into 2A. 2A is cervix, the adjacent structure is vagina. So if the upper 1/3, upper 2/3 of the vagina, if it is involved, upper part of vagina is involved, then it is stage 2A. Okay. If the side peritoneum or parametrium, if it is involved, then it is stage 2B. 2B is parametrium. 2B is parametrium. 2A is again divided into 2A1 and 2A2. Okay. 2A1 is less than or equal to, you remember that? So less than or equal to 4 centimeter of greatest dimension, and 2A2 is more than 4 centimeter. So remember one funda in carcinoma cervix, when if it is more than 4 centimeter, if any tumor more than 4 centimeter, we can't do surgery. Surgery is not done in them. Okay. So from what is the thing which is more than 4 centimeter? Okay. More than 4 centimeter. So this thing 1B3 and are remaining all except this 2A1, 1B3 and all. From 1B3, if in fact 1B3 is more than 4 centimeter. Okay, exception is 2A1. From this we can't do surgery. We can't do surgery. So what you'll do? We'll give chemo radiation. We'll give chemo radiation. Okay, that's it. So if the parametrium is involved, it is stage 2B. Now coming to the stage 3. What is that? Stage 3. So say stage 3 is involving, it is again dividing into 3 types. Stage 3A, stage 3B and stage 3C. Okay. 3A is already I told 2A is upper part of the vagina, right? So stage 3 is lower part of the vagina. So lower part of the vagina, if it is involved, then stage 3A. If the pelvic side wall, the bony things, if it is involved, if the bony things are involved, then it is stage 3B. The stage 3B is pelvic side wall. Not only that, if you see B properly, it looking like kidney. Okay. So if there is non-functioning kidney, or if there is hydronephrosis, or if there is hydroureter, then it can be stage 3B. 3C is something like if there is lymph node involvement. Again, it is given to C1 and C2. Okay, C1 is if it is involving the pelvic lymph nodes, C2 is involving the parietic lymph nodes. Okay, coming to stage 4. Stage 4 is divided into stage 4A and 4B. 4A is involving the adjacent organs. 4B is involving the distance metastasis. Okay, like adjacent organ like bladder, bowel, and all. So 4 is something like we'll prove it by biopsy proven. So understand, like if the cervix having the tumor cells, if bladder is holding the tumor cells, both will be biopsically proven that same tumor cells are present, same metastasis is there. That is this thing. Distance metastasis, you have 4B, superficial inguinal lymph nodes also comes under distance metastasis. So 4B is the one if the lymph nodes are involved. Mainly in case of stage 4, there is a term as palliative radiotherapy. What is it? Palliative radiotherapy. That means they're already stage 4, last stage. So we'll give radiotherapy for them for the few years so that they can live without any symptoms. Okay. So for that we'll give palliative radiotherapy. That's it. So in stage 3 also we'll give chemoradiotherapy. I already told from 1B3 when it is more than 4 centimeter we can't do surgery. Okay, stage 1, 1A, 1B, 1A1, 1A2, 1B, 1B, 1B2, B3 and B3 is more than 4 centimeter. Okay, so stage 2 is 2A, 2B, 2A is upper part of the vagina, less than 4 centimeter. This is only an exception where you can do a radical hysterectomy. Okay, so stage 2A2 is more than 4 centimeter, so more than 4 centimeter we will give chemoradiotherapy. Stage 2B is a parameter is involved. Even 2B also will give chemoradiotherapy. Okay, coming to stage 3. Stage 3 you have 3A, 3B, 3C. 3A is lower part of the vagina, 3B is kidneys and pelvic side walls, 3C is lymph nodes. Okay, and 4A is 4A and 4A and 4B. 4A is adjacent organs and 4B is distant buds. Okay, I hope it is easy to remember.